Welcome to Look, Live, and Be Better, where we cover the hottest trends in health, beauty, and plastic surgery. I'm Dr. Anthony Yoon, America's holistic plastic surgeon. Now, before we get started, I need to warn you that today's content is for mature audiences only. So if you have children who are listening or watching right now, this would be a good time to turn it off and come back later to watch or listen to this broadcast. But if you do this, please make sure you come back because I think you'll find today's show to be absolutely fascinating and eye-opening. Our subject this week is a controversial one in cosmetic medicine today. Although according to the American Society for Aesthetic Plastic Surgery, it's one of the fastest growing segments of cosmetic treatments in the United States, it's also a type of cosmetic treatment that I do not perform. I also have concerns regarding the use of these types of cosmetic treatments and surgeries, especially in young women. Well, today we are going to dive deep into the field of cosmetic genital treatments, specifically female cosmetic genital surgery. Now don't worry, we'll cover male cosmetic genital treatments sometime in the future, but today it's all about the women. In order to get a balanced and a sensitive perspective on this charged up issue, I've enlisted a very highly regarded female plastic surgeon to join me today on this show. So let's get started. My guest this week earned her undergraduate and graduate degrees at Stanford University, and then went on to earn her MD at the UCLA School of Medicine. She felt the call to become a plastic surgeon and therefore completed her plastic surgery residency at Stanford University as well. My guest then spent a short period of time in Boston, where she was appointed to the plastic surgery faculty at Harvard Medical School. But California pulled her back in, so she headed back west, where she co-founded Plastic Surgery Associates in Santa Rosa, California, with her husband, a highly respected plastic surgeon of his own right, Dr. Francisco Canales. Well, she is certified by the American Board of Plastic Surgery and is a member of the American Society of Plastic Surgeons, the California Society of Plastic Surgeons, and the prestigious American Society for Aesthetic Plastic Surgery. She also takes her technical skills abroad to serve the needs of children with birth defects in Peru, Honduras, Western Samoa, the Philippines, and El Salvador. Although my guest performs a wide range of cosmetic and reconstructive plastic surgery, she has made a career goal of advancing female plastic surgeons and female plastic surgery. One of her specialties is female genital plastic surgery, which will be a big focus of the show today. Well, my guest today is also an artist, and much of her work can be found on display at her practice. She has a huge presence on social media with over 100,000 followers on Twitter. I'd like to introduce my guest this week, my friend and board-certified plastic surgeon, Dr. Heather Furness. Well, thank you for coming on the show, Dr. Furness. It is such a pleasure to have you here. I'm so excited for us to kind of deep dive into this really kind of controversial topic.
Oh, well, thank you so much, Dr. Yoon. It's a pleasure to be here.
Well, before we get into this topic, one thing that really struck me about your resume and some of the things that you do is the fact that you do spend time overseas treating children with kind of birth defects and congenital issues. Can you tell us a little bit more about that?
Yes, I was bitten by the bug in high school when we lived in Kenya. My father's a plastic surgeon, and he worked as a flying doctor that year, and he flew out to the government mission hospitals, and he did a variety of different procedures from elephant maulings, lion maulings, and burns and congenital deformities. So that's why I went into plastic surgery.
How old were you when you lived in Kenya?
I was 15. And then I went back again in college and worked in a small mission hospital in northern Kenya with an Italian doctor. And he did everything. It was it was wonderful to see how much could be done with so little.
And what kinds of procedures then are you doing when you're on these mission trips? You know, what types of patients are you treating?
When I started to become involved, it was mainly cleft lip and cleft palate with some burn work. And it was really gratifying because these kids, often babies, really had no other chance usually to get their cleft lips or palates repaired. And so these parents would travel for days to come to clinic. And clinic was a little like has been like Sophie's Choice, where 150 kids show up and about 70 or 80 are the most we can do. But it's so gratifying knowing that we are changing a little baby's future. That baby's much more likely to get married and less likely to be an outcast.
What are you with a specific agency or specific group, or is it something that's more private, that's not like a big company, basically, or a big organization?
I primarily traveled with Interplast, which is now known as Research.
Oh, cool. Well, that's something that I'm looking into, hopefully this fall. So I do find surgeons like you who've really already gone and done a lot of that very inspiring. So I'm looking forward to hopefully being able to help other people as well. So I think that's great. Well, one thing that I'd like to really kind of get started talking about is this subject of genital cosmetic surgery is one that is quite controversial, and I'm sure you know that. I've been contacted by numerous news organizations to comment on these types of procedures, and for me, I try to stay away from it because, number one, I don't do these procedures, and number two, as a male, I don't know that I quite have the perspective that I think is necessary to really be good at commenting on these types of procedures and even performing them. So can we start the discussion by really just kind of going into the topic of why is female genital cosmetic surgery, why is it so controversial?
Well, it's fairly new for one thing, and so it takes a little bit of adjustment to sort of wonder why it's even being done. And the goal is to reduce the length of the labia minora. The labia minora meaning the inner lips, the non-hair bearing lips, and women come in to see their OBGYNs who see lots of women and knowing that this is normal anatomy. And so plastic surgeons are used to adjusting and changing normal anatomy. We do a lot of breast reductions. Large breasts are normal anatomy, but they can also cause symptoms. But among the OBGYNs, I think that's a difficult thing to accept, particularly given that there is controversially done, female genital mutilation. The WHO, World Health Organization, has defined female genital mutilation in such a way that it could be interpreted that labiaplasty falls under that umbrella. And so for that reason, it's important to understand why women request labiaplasty. And so I did a study that's coming out in our Plastic and Reconstructive Surgery Journal, the main plastic surgery journal, in which we looked at 50 women and asked them about their symptomatology. And they averaged about 4 out of 11 symptoms that we asked about. And then outcomes is something else we're looking at, and when we do labiaplasty, virtually all symptoms are alleviated.
So when you're talking about labiaplasty, just for the people who are listening and watching today, Dr. Furness kind of mentioned that it's the labia minora, so the vulva, basically the external genitalia in a female, those lips the labia minora can get overgrown, and in some people it can really make and sometimes it's intercourse, sometimes just normal activities like riding a bike, like going running, can make it really uncomfortable. And so the labiaplasty is a surgery where the labia minora, the external vulva, is actually reduced in size surgically to try to alleviate those symptoms. Can you explain how you perform the surgery? Is it done under a general anesthetic, under a local anesthetic, and the recovery associated with it?
We can do it either under general anesthesia, particularly if we're doing it with another procedure like a breast augmentation, or we can do it with oral sedation and local anesthesia. It's tolerated really well. Patients will take a couple of pills, wait for an hour, and then the injections are easily tolerated. And usually patients will either sleep or talk afterward during the procedure. And as far as the recovery, we consider about a week downtime, during which time they ice and elevate by getting down into what I call a puppy dog position on their elbows and knees with bottom up in the air. And then after that, they can go back to work. As far as intercourse, we tell people to wait 4 to 6 weeks, depending on exactly the procedure that we're doing.
So it's really considered more of not a major cosmetic surgery, but more of a minor one that can be done in an outpatient setting, sometimes even in an office, then it sounds like.
Exactly. I think the caveat I would say is that a lot of people underestimate the skill required, and it's very easy to over-resect. When that is done, then patients can have ongoing pain and dryness. It can be very symptomatic, and it can be difficult to correct. So it's really important to choose a qualified person to do it who has experience in the procedure.
So now, that being said, what would be your response when people say, hey, I just read an article about labiaplasty and how internet porn and the preponderance of it everywhere is causing people to look at themselves and say, hey, I don't look like those people that I see online. Maybe I need to have this surgery done. Or even worse, let's say a spouse or a male partner says, hey, you don't look like the women that I see on my computer screen or on my tablet. Let me have you go see Dr. Furness. What are your thoughts with that? Because I know there's been a number of internet-based articles written about that, claiming that may have something to do with the growth of this operation.
You're absolutely right. It's all over the place. Porn is pushing designer labias is a big headline. And so because my patients didn't come in saying, I want to look like porn, and they instead were saying, I'm really suffering daily from pain and restricted activity, I decided to ask them how many are actually looking at porn, and of those who are looking at porn, how many are influenced by porn. So 60% so far in this study don't even view porn. And of the 40%, half of them are influenced by porn, but all of those patients also express physical symptoms. Now, we also have to consider why patients might be viewing porn. Is it because that's what they're doing, or are they actively looking to see what normal female genitalia look like? Because somebody who wants a breast augmentation just needs to look down the street to see a variety of breast sizes and what size she herself might like, whereas female genitals, and that's a lot more difficult to research. And so some women may actually be going on porn just to get an idea of what's normal.
I think that's a really good point to make. I actually haven't thought about it that way, and I don't think I've seen it reported in the media that way of, people think, okay, it's porn is bad, and so because of that people have labiaplasty, so that must mean labiaplasty is bad. And they simplify it. And I think, just like you said, I think there's so much more to it. And the fact that you're actually going out there and trying to get real data about this procedure and why people are having it done, I think is so, so important. Because, I'm sure that there are patients that do feel that they're having it done purely cosmetically because they may feel pressure. And those are situations where I know for me as a plastic surgeon, I see that even with breast implant surgery. And I'll even ask the patient point blank, do you actually want this surgery done, or do you feel that somebody is kind of pushing you to do it? Because if it's not you that wants it, don't do it. You shouldn't do it.
That's absolutely right. Yeah. I constantly tell people this is not a democracy. Only you get the vote.
That's a good way to put it. All right. Well, so labiaplasty is probably the most accepted of the genital kind of cosmetic treatments out there. There probably is the most data out there for it, but there are a number of other procedures that have become popular, and I'd love to kind of dive into some of these and discuss them. The first one is Thermiva. Now, I don't have any experience with this. I have learned about it, but this is a very kind of up-and-coming type of cosmetic procedure, really, for the vagina. So can you explain how this works?
Yes, it uses radio frequency to heat up the tissues of both the vaginal vault, the vagina itself, as well as the external genitalia, in order to tighten, and it also increases moisture. So it's very helpful for women with dryness. There are other similar types of technology that use laser for the same purpose. Mm-hmm. It is new, and data is still coming out, but anecdotally, a number of our patients are very happy. It's painless. It's one of the few things that we do that really is pain-free, mm-hmm. And more people are adopting it as a practice.
So the procedure, is there any anesthetic involved? Is there any discomfort involved with it?
Surprisingly, no. It's really as long as the person doing the procedure knows how to do it, because it would be possible to burn somebody, although no burns have been reported. Mm-hmm. It's easily tolerated. It just feels warm, but not uncomfortably hot, and there is no pain.
So the way it works is my understanding, and correct me if I'm wrong, is that there's a probe that has the radio frequency energy in it, which is kind of like heat. That's actually inserted into the vagina. And does it make contact with the vaginal walls then?
It does, and then there is a temperature range that we set ahead of time on the machine, so that we don't go to a temperature that's too hot, and yet we're in the therapeutic range.
And how long does the treatment take?
It takes half an hour.
Half an hour, and any type of recovery? Does a person have to do anything afterwards?
No, it's great in that way. It's just come and go, no downtime, and it's done in a series, typically 3 to begin with, and then every 6 months you could do one.
And how long does it take for somebody to see or to feel results from that?
Typically right away.
Oh, really? Okay.
Yeah.
Yeah, I had a patient of mine who I did a tummy tuck on her several years ago, and she came back to see me for a different unrelated procedure, and she said she had recently had the Thermiva procedure, and this was maybe 3 or 4 months ago that she came to see me, and she said, Dr. Yoon, you will not believe the change in my life. She said, and she was probably in her late 50s, I think, and she said, I have not had sexual intercourse with my husband in over a decade because I've had so much discomfort when we did that it's been so long, and really that part of our life was, I pretty much said, is over. And she said, I had this Thermiva procedure done, and she said, oh my gosh, like, we are actually having sex again. Like, it's completely changed my life. And I think that it's one of those things that I would have never thought about. Hey, we use radio frequency for skin applications to tighten up skin, but I would have never thought, hey, let's actually use this to improve dryness and issues that women have, with their vagina. Like, it's fascinating how technology can really make huge differences like this.
Yeah, I think there is a much greater focus now on female genital, non-invasive and invasive procedures.
Have you had any experience with the G-shot?
Not so much with the G-shot, but more with the O-shot. The difference is that the G-shot is filler into the G-spot, which is controversial. Not everyone agrees that there is a sensitive area in the part of the vaginal wall closest to the pubic bone. But we've done a few O-shot procedures, and the O-shot is injection into the G-spot and the clitoral area with something called PRP, platelet-rich plasma. And a lot of research is being done in platelet-rich plasma. PRP, it's being used in orthopedic surgery and for wound healing purposes. Some people will put it in the facelift before closing. And so our results have been very good. It's sort of a rejuvenating method of improving sexual function.
Mm-hmm. So just to explain what PRP, and I know, Doctor, you went over it, but what you do is you draw blood out of a person's arm, and then you spin that blood and remove the platelets, which are rich in growth factors. And so the idea really is that if you inject this platelet-rich plasma, these platelets that are rich in growth factors, into parts of the body, you can get these great rejuvenative effects. So I have discussed it on shows before where it's actually being used for thinning hair, and that appears to help. You mentioned some people will inject that for facelifts. I've tried injecting that into the face to try to plump up the face. I haven't had great results with it. I do see some results, but not as good as with all the great fillers that we have nowadays. And this is kind of a new approach. Is there any data behind it that you know of, any scientific studies? I know you're 100% all about the science behind it.
Right, exactly. And it's still not confirmed. It's more anecdotal at this point.
Okay. So, I mean, it's an interesting field of this kind of cosmetic genital surgery. I mean, there are more of these for women right now than for men. I do want to discuss in a future show some of the things that we're doing for men as well. But I know your big thing and your focus really is female plastic surgery, but also female plastic surgeons. And you have published a couple of articles I think have been absolutely fascinating that I'd love to discuss with you. Now, really, when you look at plastic surgery, it's always been kind of a male-dominated field. And I have mentioned on one show that I was on where with labiaplasty surgery, I was looking at a conference, thinking about attending it one day, and they had a panel on labiaplasty and female genital plastic surgery. And on that panel were 3 men. Each of them were probably in their 60s. And I thought, what is going on here? Could they not find a female plastic surgeon that does this to go on this panel? And as you and I know, it's like there are not nearly enough women who are plastic surgeons nowadays. How has this driven you? How has this affected you being a female in such a male-dominated specialty?
Well, to be honest, I don't know that I would have, if my father were something else, that I would have gone into plastic surgery because it is so male dominated. The year that I entered medical school, those applying to residencies, only 2% of the surgeons were women.
Wow.
Entering training. But I saw the work that my father did, and I like art, I like sewing, and it just seemed a natural. And I didn't really realize the culture, that it was really so male dominated. And the reason, of course, is surgery started out on the battlefields and women were at home, and it was natural that it was male dominated. Mm-hmm. But through the years, the number of women have increased. So now we're about 14% plastic surgeons, mm-hmm. And there are 37% who are training. So I want to give a shout out to Dr. Rod Rohrich, who is mm-hmm. editor-in-chief of Plastic and Reconstructive Surgery, because he came up with the idea of running a series of articles and videos on women in plastic surgery, recognizing that there is a change, that we have to look at some of the challenges and how we change them. So I'm one of 4 guest editors that are organizing this series of articles in which we look at, as you mentioned, Dr. Yoon, that there are not enough women in leadership or up on mm-hmm. the podium. We're looking at why that is. Negotiation. It turns out that women don't negotiate as effectively as men, but when they do, mm-hmm. they pay a dislikability tax, if one way to put it. In other words, they're less liked, and so some women may consciously not push in negotiating because they know that there could be repercussions. Work-life balance is an issue. The traditional track of surgeon being, working 80 hours a week and married to a woman, a wife who raises kids, is changing. And so with more women in the profession, and frankly, more men looking at work-life balance, we're looking at how the both training and residency can change. And then I just published an article in PRS on pregnancy in the plastic surgery resident. And the reason that is so pivotal is because our years of training, as you know, are so long, and the hours are are long as well. And so it's really difficult to have a kid during residency. And there was a study previously done in 1995 by one of my co-authors that showed that women in training had a 26% abortion rate, elective abortion rate, compared with 8.7% in other medical specialties. And none of the chiefs knew. So these women were quietly not getting pregnant by having elective abortions because it would be so disruptive to the training program. Other already overworked residents would have to cover. And there was, there has been no maternity leave or minimal maternity leave. So we just did a survey that showed that we surveyed the directors, the program directors. A third of them have a maternity leave policy, but it's very bare bones, and they're sort of looking at the requirements for training against the Family Leave and Medical Leave Act that gives 12 weeks. So there are a lot of contradictions. We've come up with some suggestions, and I think things will change.
Yeah.
They have to.
Yeah, and that's something that always has been an issue for me as well. I mean, I wrote a book where I kind of discussed what it's like to go through medical school and how intense it is. And residency, it takes that to the next level. And there is that feeling. It's interesting because here we are, we're physicians, or as a resident, you're training to be a practicing physician. You're there to basically learn how to be a health advocate for your patients. Yet, if you get sick, if you are ill, unless you're literally going to have surgery, you're expected to be there and to show up. And even if you have to have a barf bag, in your hand while you're seeing patients, you need to show up. And there is, at least where I trained, and really where I trained in Grand Rapids, was about the most benign, the kindest of the programs out there, really. And that's why I really loved being there. One reason. Even there, it was difficult. And to think that, oh, by the way, I'm going to have a baby and I'm going to be gone for 10 weeks or 12 weeks. I agree. I think there's a lot of stress. I think there's a lot of expectations there that you don't do that in general in medicine.
Exactly. We actually have a video coming out through PRS in which a number of women tell their stories, and a number have had like 2 weeks leave after a C-section, or they're carrying the beeper while they're on a drip to before receiving medication before having their baby.
Well, and I think especially in surgery, there has for a long time been this mentality of, I was treated this way and I turned out fine, so you can deal with it as well, and really I think that paradigm needs to shift. I do think it is shifting, I mean, back when you and I went through residency, we do 36 hours straight without sleeping, and there are at least rules and stuff now where I think that's happening much, much less.
Exactly.
Well, I do want to touch on, you do have an article that you did briefly mention, kind of how more and more women are becoming plastic surgeons. But I do think that it's important to realize that 90% nationally of plastic surgery patients are women. In my practice, when we have looked at those numbers, it's the same thing. Yet you did write a paper recently showing that if women had their option of choosing whether they want a female or a male physician, they do tend towards choosing female if given the choice. Can you explain kind of what you found?
Yeah, it was interesting. I actually didn't think that there would be that, a particular favoritism for one gender over another. And so I asked our staff to do a study. And so we looked at 200 people calling in for consultation, and they were each asked if they wanted a male plastic surgeon or female. And then the staff recorded whether they said male, female, or whether they said, my husband, Dr. Canales, or me, Dr. Furness. 26% of the patients said that they wanted a female. 1% said they wanted a male. Now, of those asking for a specific, and I should say that almost half didn't care. But between those who asked for a specific surgeon, slightly more requested my husband than me. It wasn't statistically significant, but it certainly shows that reputation is far more important than gender. But if a patient doesn't really know about one surgeon versus another, she might tend to drift towards the female, which is confirmed by other specialties where women, particularly requesting a consultation over something intimate like a pelvic exam, is more likely to ask for a female doctor.
Did you find that also with the female genital plastic surgery for labiaplasty, that women preferred a female surgeon in that situation?
Yes, there were in that study, 13 patients came in. One said she didn't care, and the rest either requested me by name or wanted a female doctor.
Yeah, no, and I think that that's important that there are so many more female plastic surgeons entering residency. I know when I went through residency, there were 10 residents, so two residents a year for 5 years, and I think there were 2 of them when I was there that were female. So it still was a small number, but I do know that number is definitely increasing. So I think it's super important. I mean, it's kind of like that. You see, I think the same trend I expect with OBGYNs, where my dad was an OBGYN, and all the OBGYNs that were around when he practiced 20 years ago were pretty much mostly men. And now I do think that there has been that shift towards women because, I do think that a lot of women feel more comfortable with a female doctor.
Yes, and there is the same trend, men favoring men too. It's just that in plastic surgery, we, as you said, 90% are women as far as patients.
Yeah. Well, you can find Dr. Heather Furness at enhanceYourImage.com. You have a private practice in Santa Rosa, California. And can you explain the types of procedures they do? Obviously, we know you do the female genital plastic surgery we talked about today, but what other things do you specialize in?
We're aesthetic surgeons, and so my husband and I work together, and we do face, breast, and body, and we love all of it. We love the variety, and we're able to meet patients' needs that way because oftentimes they have several requests.
Yeah, well, it's been such a pleasure having you on the show today. I'd like to ask you one question that I do ask all of my guests kind of at the end of the interview. Basically, it's if you could give one piece of advice, one tip for our listeners, for our viewers today on how they can make their lives look, live, and be better, what piece of advice would Dr. Heather Furness, board-certified plastic surgeon in Santa Rosa, California, what would she give?
I would say do something meaningful with your life. I think that when you're doing something that helps others, then physically, mentally, everything else falls into place. I think if you're focused sometimes on specifics that you can't change or that cause stress, then that can have an impact on how you feel. So I think if by contributing, by doing something meaningful, everything else more easily falls into place.
I think that's great advice. So if you want to learn more about Dr. Heather Furness and her associate, her partner, her spouse, Dr. Canales, visit her at www.enhanceYourImage.com. That's enhanceYourImage.com. If you are in California and you're looking for a great female or male plastic surgeon, give them a call. They're in Santa Rosa, California. Thank you so much for coming on the show.
Thank you, Dr. Yoon. It's been a delight.
So this has been Look, Live, and Be Better. I'm Dr. Anthony Youn, America's Holistic Plastic Surgeon. I will see you next time for another fun and exciting program. Thank you. Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I spent the past 17 years learning the secrets to turning back the clock and have written all the best of these secrets in this book. This includes the Age Fix diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is, from age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out The Age Fix. Now, if you purchase it on my website, dryoun.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making The Age Fix such a huge success.